Hi, my name is Alex Ghanayem, and I'm joined by my colleague,
Dane Salazar. Good morning.
and today we're going to discuss the value of an advanced degree. Dane, you have your master's, is that correct?
Yeah, I got a master's in business administration from Mendoza Business School at Notre Dame University.
And right now, what is your position in orthopedics?
I'm an academic shoulder and elbow surgeon at Loyola University in Chicago. I work for you. And I also am the vice chairman for clinical affairs, working on the operations side of running the department.
So let's just start with something really simple. What motivated you to pursue an MBA?
So I was originally in the military as an active duty physician, and so I really grew up in a socialized medicine model. And when I got out and went into civilian practice, I was interested in learning more about healthcare, operation systems, cost, and really just the business of running a department or a practice. And I have a degree in economics, and I was interested in learning more about the business of modern healthcare.
So, if I understand you correctly, your entry into the civilian practice of medicine, we'll call it delayed because of your service to the country. Do you think by pursuing this advanced degree, you caught up to where someone, let's say, right out of fellowship would start practice and would learn some of the things you learned in your MBA program organically?
Yeah, I would argue that in our traditional formal training, such as medical school, residency, and fellowship, we get very little exposure to the topics that an advanced degree, whether that's an MBA, a Master's in Public Health, an MHA, an MJ, or a JD, those programs really broaden the education that physicians get. And so I'm not sure that it necessarily caught me up, but it certainly broadened kind of what I understood was our healthcare system. And I really learned a lot of kind of unexpected things. I thought I was going to learn more about accounting and finance and really the nuts and bolts of running a business, and I got so much more out of it than that.
So let's talk a little bit about timing. I mean, you came into practice, and I think shortly thereafter you started with your advanced degree, your MBA program. I know in a number of non-healthcare related high-end MBA programs, they want people working for 5, 6, 8 years after college before starting the program. What is your opinion about timing?
Yeah, I mean, the short answer is there's really no ideal timing for a busy practicing orthopedic surgeon. And so it really depends on what your goals are, whether you do it early in your career, like a joint program, whether you do it mid-career or late career. And so for me, I chose a program, I was kind of mid-career, and the program required about, on average, 12 years of industry experience. And so it was really an executive program for people that had been in their chosen industry and were looking to get more into executive leadership. And so I think the easy answer for me is the timing is really when your work boss and your home boss, whether that's your spouse, life partner, goldfish, roommate, when those two people agree that it's going to be possible. And so there's really no ideal time to go back to school. It's a huge financial commitment for many people. It's a huge time commitment. So for me, it depended on, how it would impact my clinical practice, how it would impact my work-life balance, and how it would impact my patient care. And so finding the balance of when I could work that in. And so the ideal time for me was kind of mid-career.
You want to know a little secret?
Sure.
When you asked me about taking time off to do that, I checked with your home boss.
Yeah, that was wise. I also checked with my home boss.
Yeah. So once again, you're a little different in your scenario, coming out of the military and having experience in practice. But to a traditional orthopedic surgeon in terms of time course and training, would you suggest 5 years of practice or 10 years of practice or would you suggest doing it early on when you're not quite as busy so you have more time?
Yeah, I mean, I think it again comes down to what your goals are. If your goals are executive leadership at your institution, leadership in your given subspecialty, leadership in the AOS, leadership in the AOA, then I think you really want some industry experience. You want to be in practice. You want to have some of that understanding. However, if your goal is really to get additional education so that you can successfully run a business, be that private practice or an academic practice, then it may be suitable to do it early in your career so that you have a concept and an understanding of not only the clinical side and the scientific side of medicine, but also the day-to-day operations side, be that revenue generation, be that profitability, be that cost, logistics and cost cycle and things of that nature. And so I really think it depends on finding a right program for the right person, and then what they want to get out of it really dictates the timing of when it's appropriate.
So what's it like going back to school? I mean, do you pack a lunch? Do you have your old G.I. Joe or Charlie Brown lunchbox? And what happens in that whole process?
Yeah, it's actually interesting. And what I found out is that my own angst about going back to school, the doubts, fears, anxieties that creep in about that were completely different than those of my classmates. For my classmates, many of them had not taken a written test in decades. They had not read for anything other than pleasure in decades. And they were nervous about going back to a classroom and being in a school environment because that was very foreign for them. And I noticed for me that all came very naturally. I think as orthopedic surgeons, we're lifelong learners. We take standardized tests. We've been doing that our whole careers. We read for work, be that peer-reviewed publications, be that book chapters, be that preparation for the operating room. And so reading for other than pleasure, doing schoolwork, being graded, being evaluated, giving public speaking, those things didn't worry me at all. For me, it was more being away from my practice, being away from my family, and what was the time commitment going to be. And the other thing that I think that we as orthopedic surgeons need to give up on a little bit when it goes back to schooling is that for me, the goal was not to prove to anyone I was good at going to school, right? Getting an A in a class that I didn't take much away from or I couldn't use anything in practice or bring back to the department, to me was not a successful course. A course that I didn't get an A in but was able to take something to my practice or my patient care or bring to the department could be a huge success. And so success was no longer defined on what grade I got in the class. And that really took getting used to for me because I think orthopedics very much attracts driven, competitive people. And so I had to start to let go of the grip on, hey, I want to be number one in my class, I want to get straight A's, and start to define success as, hey, I want to take the most out of this program to my patients, to my practice, and making the institution that I work at better.
So that impact, if you will, how many years has it been since you finished the program?
I finished in 2018, so it's been about 4 or 5 years.
Okay. So how has that impacted your practice? I know there's been a COVID problem in the middle there, but tell us how it's affected you.
Yeah, I think the first and most obvious thing for me is networking. So I learned probably as much from my classmates as I did from my professors and teachers. And the reason for that is I had classmates that were CFOs, COOs, CEOs. And so I have a Rolodex of people that are in multiple different industries that when I'm faced with a certain scenario or question at work, I can call that person up. If I'm trying to do some financial modeling, I go to one of my classmates that is an accountant or in finance and really bounce things off of that person. And so it really gave me a huge network of people that have very specialized talents that I'm really a novice at. I mean, I think going and getting your MBA doesn't make you an investor, it doesn't make you an entrepreneur, it doesn't make you an expert business person. What it does is it immerses you in that world, and you get a kind of a cursory understanding of general topics in that world, but I'm not an expert in any one of those topics like many of my classmates are. I'm an expert in orthopedic surgery, whereas they might be an expert in marketing, accounting, finance, investing. And so for me, it has allowed me to look at other industries and see all of the things that they do very well and see if I can transfer that to healthcare and say, hey, is there something I can take away from the way that company does marketing and bring that to Loyola? Is there a way that supply chain management at that company can be brought to healthcare? And so that's really what it's done for me. It's allowed me to do systems thinking, to not only think as a physician and a scientist, but also to think about the overall business and the value proposition that we have to our patients.
So I'm going to take a little leap here then. If I understand what you're saying, is all this really about language and communication? I mean, you're not an expert in accounting. You're not an expert in financial modeling. But with those connections you've made and what you've learned, the issues that are germane to the practice of orthopedic surgery and providing patient care, as it relates to the business world, you can speak that language. And you're not going to do financial modeling. You probably could in your spare time, but you're going to consult an expert. So is this really about your ability as a practicing physician and as a leader to speak the same language of those in the business world, to leverage that and then be successful?
I think that's an excellent point, and you're absolutely correct. I think as physicians, our entire formal training has been immersed in clinical care, surgical knowledge. And so some of us, including myself, when we get in the administrative setting and with that language, we're not as comfortable, but we still have this feeling that we should know the answer. We're talking about contribution margin and we're nodding our heads. And for me, it was learning, well, what exactly is contribution margin? How is that calculated? And it allows me to kind of translate a clinical argument for a program or a patient care initiative or a cost item or a new innovation, and take that clinical argument, which everyone would agree is a good argument, and translate it into an argument that administrators can understand, which is typically a financial or a budgetary type of argument. And so I totally agree that it has given me kind of the ability to translate clinical thinking into administrative thinking, which has allowed me to kind of push forward initiatives that I think are very important and impactful and help our ability to provide world-class care to our patients, which is ultimately what it's about.
So I want to challenge you again a little bit, since I've gotten you to agree with me on that concept. So you remember back in medical school, you took that microbiology course and the pharmacology of drugs we'll never use. And of course, you don't use that at all in your practice. It's out of your mind. It's done. So if someone were to challenge you and say, why take a full-blown master's course? Because there's things in that educational program you'll never use. And if this is really about language and communication and being able to understand what the other side needs in order to help you be successful, I'm going to present to you two additional ways to do that. And one is through an AOA Apex type course, where you're not getting into the weeds per se, but you're getting into the concepts and communication skills and principles. And the second way, which is a big part of what the AOA does, is mentoring. I don't have a degree, advanced degree. I think my skills have been picked up through mentoring from other people, both in the healthcare business side and healthcare professional physician side. Are those two pathways equal, not equal, or just as good as getting an advanced degree?
Yeah, I mean, I think it's a complex question, and it's a good question, and I think it really comes down to what are you trying to get out of a program and what can you get out of a program. And I think the Apex program is an excellent program, and I don't think it's mutually exclusive from getting an advanced degree, I think there's a lot that I could learn by going to the APEX program, having an MBA. I think there's a lot that can be learned from the APEX program as far as networking, mentoring. And so I think non-degree programs like that, including AOA's APEX, are extremely valuable to practicing surgeons. The reason I chose the MBA, again, as I mentioned, is I do have a degree in economics. I have a background in international finance. And so I did want some of the kind of traditional accounting, finance, investing, strategy type of courses. And for what I wanted to get out of the program, I think a degree master's program was very appropriate. And looking back on it, I would not have changed anything. But I think it's very important when we decide on these to choose the program that best suits our goals and to maximize what we would consider the return on investment. And we have to be honest on how we define that return on investment, because it is a huge opportunity cost. I mean, it's for many people a very large financial endeavor. It's certainly a very large time commitment. And a lot of people will ask, well, how do you calculate the opportunity cost on deciding between program A, program B, and program C? And ultimately, it comes down to what would you have done with the time otherwise? And if the answer to that is, well, instead of spending 2 years on the MBA program, I would have gotten an NIH grant for $5 million to further my research into curing sarcoma, then maybe an advanced degree opportunity cost is not a great solution in that scenario. But for most of us, including myself, if the answer is watching more ESPN or doing more leisure reading, then the opportunity cost can certainly tip into our favor. And so I think there are many programs out there that enhance our leadership ability, enhance our emotional intelligence, improve our communication skills, allow us to network and mentor, and those are all very, very important parts. And honestly, those were the surprise parts of what I took away from my program, where I conceptually thought I would get basically the building blocks of how to administratively run a business. And what I really walked away with is a lot more introspection about my leadership style, a lot of tools with communicating and strategic thinking, advanced marketing, and things of that nature. And so I think I had a lot of preconceived notions of what I was going to get out of it, and those were completely different than what I actually got out of it. And so I think non-degree programs are very appropriate, and for most practicing orthopedic surgeons are probably what they want to get out of programs. So your point is well taken.
Is there a, let's just say hypothetical age of 35, 45, and 55, is there a break point where perhaps a formal degree program may be more advantageous versus an APEX style non-degree program?
Yeah, and if we take those three kind of, so early career, mid-career, late career, for the late career person that's transitioning into an executive leadership, maybe moving from being an orthopedic surgeon into being a chief medical officer for a hospital system, being a managing partner of a large private practice organization, being the CEO of a hospital, or leading a large type of medical corporation, be that medical sales or industry relationship, that person might be better served with a formal degree program because it does give them quote-unquote street credibility, especially in the corporate world. For the person in mid-career, if they're looking for advancement professionally into executive leadership in their subspecialty, in their practice, in their department, at their hospital, I think non-degree programs in leadership, such as the AOA's APEX program, would be very well suited for that person. And I think in early career, it's hard to say because it really depends on what that person who is very early in their career wants to achieve in their long-term career, call it the 15 or 20 or 25-year plan. And if that person wants to run a large hospital system or has aspirations of having entrepreneurship or business or be very involved with policy and advocacy and government relations, negotiations, then it really depends on which program would be best suited for them. So I think the answer is that we really need to be individualistic in what our goals and aspirations are and pick the program that's best to achieve those so that we maximize our return on investment.
Let's circle back to the mentoring question. Can that serve the physician well? And if the answer, if the answer is yes, does that person eventually develop that street cred that you would get from a formal degree program or an APEX style program? And if the answer is no, why?
Yeah, so I think mentorship is really quite paramount, especially in orthopedic surgery. And certainly I feel exceedingly indebted to all of the wonderful mentors that I have had that have opened so many opportunities for me. I think that sometimes in orthopedic surgery we can get into feeling like we're a little bit on an island, and that's when mentorship's very important. And there's formal mentorship, and then there's informal, organic mentorship, and I've certainly had both in my careers. And I think that there's lots of different ways to achieve mentorship. The important thing is that people are getting access to that. And for some people, especially if you're in private practice, especially if you're in a small private practice group or a solo practitioner, it can be much more difficult to have access to mentorship. And so for people of that type of practice model, I think those programs are very important for networking and getting plugged in and not feeling like you're isolated and feeling like you have resources when you have questions about practice management, supply chain, and things of that nature. For me personally, I felt like that the degree program didn't really advance my orthopedic mentorship. It opened a lot of networking to have mentorship in different industries that I would never have had access to. And so I think that for career progression and even for professional reward, feeling connected, having relationships, and that coaching aspect is very, very important. And so I do encourage people that whatever that looks like, if you don't have great mentorship in your practice, that you seek out those opportunities. And I think the AOA as an organization is superb at doing this. I mean, I think that really the AOA is the true birthplace of leadership in orthopedics in this country, and has a rich history of having these wonderful generational leaders involved with this organization. And so for me, it's a great honor to come to the annual meeting and really feel like I'm just moving through my career on the coattails of these people that have made great advancements and have great leadership qualities that I try and emulate in my own career.
So rapid fire, an advanced degree, it's a great thing, but not for everybody.
Correct.
The key is you have to have appropriate goals, mindset, and vision before entering into one of these programs.
Agree 100%.
Non-degree courses can be exceptionally valuable or even a precursor to an eventual advanced degree.
It could be a precursor, it could be an adjunct, it could be a refresher. I mean, I think for someone that did an advanced degree earlier in their career, doing a program like APEX at mid-career or late career only enhances and refreshes all the strategies and tools that they got in their degree program. And so I think those programs are invaluable, and also their timing commitment, the financial commitment, and the disruption to your work-life balance in your clinical practice is less impactful. And for many people, that can absolutely be the right decision. And so I'll make a kind of a biased plug. We have a panel symposium that will be recorded today from the annual meeting that's basically titled Healthcare Leadership, Is an Advanced Degree Necessary? And so we have multiple panelists talking about the different degrees and non-degree programs, including AOA's APEX. and their experiences and what they would have done differently about that. And so I do recommend that if you're interested in this topic, that you listen to that recording. We have some great panelists giving excellent insights into the MPH programs, the MHA programs, the MBA programs, MJ programs, and then AOA's APEX.
And then, regardless of which program, degree or non-degree, mentoring is a critical part of ongoing learning and career development.
I totally agree. And the one thing I would say is, when I look back on my motivation and what I got out of my going back to school, there are some individuals that have inherent and innate talents that we can all identify. They're just natural leaders. They have great communication skills. They have great strategic vision. And they have gained those things, as you've said, organically moving through their careers. But for those of us mortals like myself, it is a nice packaged content for a lot of those things to improve our emotional intelligence, to improve our communication skills, to make us and challenge us to think more strategically and more operationally. And so for me, it was kind of a one-stop shopping for many of those talents that other people have organically kind of achieved throughout their careers. And so there are some people that don't need advanced degrees because they already have all of these talents and they've done it on their own. But for other people like myself, it was a great way to get a lot of intensive immersion in these topics in a short period of time.
So real quick, yes or no, you're a strong advocate for advanced degrees or at least non-degree programs that would be adjuvants to orthopedic training?
My definitive answer would be yes, maybe.
And what's it like working for a guy that has never had an advanced degree or a full program, non-degree program? And you don't have to answer that if you don't want to.
It's been the greatest pleasure and honor of my career. No, the reality is, it's all about adding value to your organization. And so we want to be synergistic in our organizations. And so each individual is not going to have all the strengths. And the key is to surround our leaders with people that have different strengths that feed off of one another. And so, we all have biases, we all have blind spots, and so the key is to surrounding yourself with people that can help augment those things. And so, for me, I don't think every leader needs advanced training, but I think that we need to be very good at working with one another in teams and identifying that certain individuals have value-added talents. And so for me, I consider myself a lifelong learner, and I learn more from my partners and my bosses and our trainees, residents and fellows, more than I ever teach. And so I feel very blessed to be at an organization where I get to learn every day and get to continue to better myself as a scientist, as a clinician, and as a orthopedic leader.
So you don't need to be the smartest person in the room. You just need to know how to find that person.
Totally agree. And, we had Dr. Evan Flato, who runs a very large hospital system in New York. And his opinion was that he didn't need an advanced degree. What he needed to do is to be a good listener and to enable very talented people and recruit and retain talented people that had the skills that the organization needed. And I think that's hard to argue with his thinking. My rebuttal to that a little bit would be that at the very least, I want a cursory knowledge so that I can communicate with those people and they can communicate with me, and I can understand what are these accounting concepts, what is this supply chain or logistic concept, and I can have more than just a very superficial knowledge of that. But for certain people that are very fast, talented learners, you can do that on your own. For me, it was I want to know basic accounting concepts so that when I talk to administrators, I can understand where they're coming from. And so, yes, it's not for everyone, but certainly if asked, would I do it again, the answer is that's a no-brainer. I absolutely would. And if asked, did I get out of it what I thought? My answer would be, I got out of it way more than I could have ever imagined. And so for me, that's how I defined return on investment, that I really got lifelong friendships, great mentorship, great coaching strategies, and some basic value propositions that I was able to implement in my day-to-day professional life almost immediately.
So in the end, I think the final answer would be do something. Immerse yourself into a degree program, a non-degree program, active mentorship, communication, lifelong learning, and then there's something for everybody.
I totally agree.
Well, thanks for participating on this podcast, and we'll see you on the meeting floor.
Thanks for having me. I appreciate it.